right, my next guest is the founding director of the Yale-Griffin Prevention Research Center, who recently volunteered his time fighting COVID-19 at a hospital emergency department in the Bronx. Please welcome Dr. David Katz. Doctor, thank you for being here.
Thanks for having me, Bill.
Credentials for talking about this are impeccable. I know you were at the Einstein College of Medicine. You got your degree, the Yale School of Public Health. Nobody questions your credentials. Some people question your op-ed that was in the New York Times about a month ago. It was called, "Is Our Fight Against Corona Worse Than the Disease?" I think it's good someone's at least asking that question. We can't just lapse into groupthink. Let me quote the thing you said recently that I think is most interesting and gets at this point. You said, "If all we do is flatten the curve, you don't prevent deaths, you just change the dates." Explain that.
Yeah, and Bill, first of all, again, thank you. Great to be with you. Uh, that's taken directly from some of the world-class risk modelers that I've been working with since that op-ed in the New York Times. So I wrote my op-ed. Tom Friedman wrote a column channeling mine, ran it up a high flagpole, and then a who's who in public health and economics found me, and we've been working together ever since. And so some of these risk models basically show, essentially what flattening the curve does is keeps people away from one another and away from the virus. So the virus doesn't spread, but you also don't cultivate any immunity. If you do a really effective job of locking everybody in place and preventing viral transmission, there's still some low level potential for viral exposure out in the world, but very few of us get that exposure. The minute you release those clamps and let people back into the world, we're all vulnerable. So most of the models suggest that flattening the curve makes sense in phase one so you don't overwhelm medical systems, for example. But you've got to have a phase two. If you don't transition to a phase two, whenever you release the clamps, the virus is out in the world waiting for you. Everybody's vulnerable. And that big peak in cases and that big peak in deaths that you were trying to avoid really just happens at a later date.
So you would be suggesting something more like what Sweden is doing? Sweden, we know, has kept open its schools. You can go to a bar, you can go to a restaurant, and get your hair cut. They haven't had numbers that are that different from countries that have locked down. How do you sum up that?
Yeah, let me start, Bill, by saying essentially what I reject, because I think we're a very polarized society. I think the way media hype things up actually amplifies the extremes. So at one extreme, we've got the, lock everything down, hunker in a bunker until A, there's a vaccine, 18 months or years or whenever, B, forever, or C, you die of something else, whichever comes first. That's just horrible. It's inhumane, makes no sense. But at the other extreme, we've got the liberate blank, fill in the name of the state, which is basically, everybody in the water, including grandma, and never mind the riptides and the sharks and, every man for himself. That's also absurd. So in the middle, what you do is you identify who is at risk of a severe case of this infection and who's not. Who is at risk of dying of this at a pretty high frequency, and who's at extremely low risk. So this is just like risks we take every day. Yeah, some young people will die of this, but sadly, tragically, some young people die crossing the street or in a car crash every day. There are risks we willingly take on every day. Sweden's approach is a little too close to the everybody in the water, don't worry about the riptide end of the spectrum for my taste. I think we can do even better. We can kind of look around the world and say, okay, if you don't lock this down at all, if you don't protect the vulnerable, mortality in Sweden does look to me to be higher, not massively higher than every place else, but higher. Why put those lives at risk? On the other hand, if you lock everything down, you destroy livelihoods, you destroy jobs. And what I was saying in what I didn't really think was a controversial op-ed at the beginning is there's really more than one way, Bill, for this situation to hurt people or even kill them. And all of them are bad. And there's more than one way to protect people and save them, and all of those are good. So one thing we want to do is keep those vulnerable to severe infection away from this nasty bug. But we don't want to destroy people's lives and livelihoods and means of feeding their families. And interestingly, I am just back from 3 days in an emergency department in the Bronx where I was volunteering as a physician to support my colleagues who I applaud. They've been in there from the beginning; they'll be there through the end. But this is exactly the view that prevails there. There might be the notion that, well, the frontline people, they're much more concerned about staying away from the virus than they are about, can we open society up? Not true. Their parents, I was talking to my colleagues who say, I'm really struggling to balance my clinical duties with homeschooling my kids. And then, think of a scenario like this. Dad is a nurse, mom's a paramedic, they've got two kids at home and there's no school, no daycare, no nannies, no au pairs, nothing for them to do. One of these frontline people who really wants to be in the battle has to stay home to take care of the kids, and they're really torn. So there's a middle path, and the middle path essentially is high risk people are protected from exposure, low risk people go out in the world early. And here's the odd part, Bill, that I think people have a hard time confronting and accepting. We actually kind of want to get this and get it over with and be immune, because that is the path to the all clear that doesn't require us to wait for a vaccine, which optimistically is 18 months away, but could be much longer.
Yeah, I think you make a lot of sense there. And I think it's a shame you're talking about politicization, that people like you who sound reasonable, maybe it's not the exact one true opinion you hear somewhere else, has to go on Fox News to say it. You're not a Fox News guy.
I'm not a Fox News guy, but on the other hand, I am a bridges, not bunkers guy. And, it doesn't really help the world if all we ever do is talk to other people who already own our opinions. It was interesting. I really debated, do I go on Fox News? Do I not? That's not my usual crowd. But the simple fact is, we should come together in common cause on common ground. Maybe there's a real opportunity here for an aha American moment that's between the extremes of left and right, where we all say, yeah, actually, we want to save as many lives as possible. And, one of the interesting things, Bill, it's sort of the left side of the spectrum, the liberal ideology that seems to be so resistant to talking at all about unemployment and the economy. But that's the very same camp that tends to appreciate that the single leading driver of bad health outcomes is poverty. Social determinants of health are massively important. So, frankly, 30 million people unemployed, that falls disproportionately hard on the people who can least bear the unemployment, who are at most risk of food insecurity, who are at most risk of depression, addiction. All of that's important too. So maybe there's a real opportunity here to say, hey, there's a middle path. We've been neglecting it. It's the way through this thing. And it leads to total harm minimization. We want to minimize deaths and severe cases of the infection. We also want to minimize the fallout, the health fallout of societal collapse and economic ruin.
Yeah, I think philosophically, America got too used to the idea of win-wins, and they need to get used to the idea of lose-lose. That's more what life is like sometimes. Lose. There's no good choices here. There's only the least bad choice. And, I think when you talk about the fact that we have this president who is so inept at dealing with this, but he's not going away. He's not going away. He is the president. He's going to be there. Let me ask you this about testing. It doesn't look like we're going to have testing for a long time. So, look, in the war movies, when they say to the pilot, your equipment is out, he says, I know, but we're going to have to fly blind on this one. Is that this kind of situation? Are we just going to have to say the least horrible choice is, at some point, we might have to do this without the testing? The people who say we can't open up the economy until we have the testing, well, that can't go on for a year, and we might not have the testing till then at the rate we're going.
So a few things. So you said it's not win-win, it's lose-lose, in a sense. And in public health, we talk about harm reduction. So for example, a needle exchange program that says we can't get everybody to stop using intravenous drugs, but we can give them clean needles so they don't get HIV, for example, that's harm reduction. And so when you're in a lose-lose scenario, you look to minimize harm. Maybe you can't maximize benefit, but you can minimize harm. So from the beginning, we've been posting materials, my colleagues and I, under the rubric total harm minimization. That's what we want to achieve here. Yeah, listen, a historic pandemic is a bad situation. A historic pandemic with a fairly, inept group of federal leaders is an even worse situation. If only we had grown-ups in charge. But on the testing front, we're making a mistake there, Bill, because we do have testing. It's not great, by the way. So one day, one of these 12-hour shifts in the emergency room in the Bronx, we admitted maybe 20 people we were sure had COVID. There was just no doubt about it. They positively had COVID. Um, and either 19 or 20 of them tested negative. So that the testing's not great, and the false negative rate is high. But some of the test kits work pretty well. They're certainly better than nothing. And here's the thing: what we aren't going to have anytime soon is the capacity to test the whole population. But we deal with that all the time. The CDC routinely does what's called representative random sampling, where they randomly select people and make sure that they traverse the gamut of age and socioeconomics and zip code and health status. And then you extrapolate the whole population. We could do that with 10,000 people. And we have the test kits for that. So we really need grown-ups in charge. We need federal oversight. We need a commitment to getting the critical data. And frankly, that could happen fast. It's the work of 72 hours. In the absence of that, we're turning to states. So for example, we just heard there's widespread testing in New York. I think Governor Cuomo's doing a great job there. And it looks like at least 20% of the population of New York may have antibodies. Well, that's close to 4 million people. And what that means is the death toll in New York, tragic though it is, and again, all these deaths are real people, and my condolences to the families. But just looking at the statistics for a minute, 20,000 deaths out of 4 million people, that's 0.5%. We're starting to see that the mortality toll of this, when you get the denominator, is really small. And I think the denominator is even bigger than that. So we're not totally blind. Yeah, I think we do have to fly in a bit of a fog, but we're not flying totally blind.
Okay. I worry when I hear people talk about how we deal with this, that they leave out the immune system. I mean, obviously, we know that that's a big part of it, but I feel like that gets such short shrift. And I worry that the country is going to think that the way to deal with microbes in the future is to lock yourself away. And it cannot be that. Germs are ubiquitous. They are everywhere. You can't avoid them. You have to win the battle inside. You wrote a book recently called How to Eat, which has been a pet theme of mine since I've been on television, that the main thing about our health is what we eat. And you write 80% of all chronic disease and premature death is preventable using lifestyle as a medicine. Yes, stop shaking hands, but you can't avoid germs. They're everywhere.
Yeah, so great point, and a great segue. So first of all, I just want people to understand, again, I'm a physician, I do public health, I'm trained in epidemiology. It really still looks to me, as it did that month ago when I wrote my piece for the New York Times, 98 to 99% of the cases of this infection are mild. Most people don't even seem to know they have it. And this is true even in the emergency department. A small portion of the cases are potentially severe. And that's what makes your point so important here, Bill. The severe cases occur in people who are old and people who are sick. Now, those two things go together, but sadly in America, they also splay apart. There are a lot of young people with coronary disease, obesity, type 2 diabetes, hypertension, and by and large, those are diseases of lifestyle. I'm a past president of the American College of Lifestyle Medicine. That's what we advocate. Lifestyle is medicine because it can fix all of that. Here's the interesting bit. The stuff we can't sell to people: eat well, exercise, don't smoke, don't drink excessively, get enough sleep, manage your stress, because it's such potent medicine. We can't sell it because the timeline for harm is too long. Essentially, heart disease stalks you in slow motion. Type 2 diabetes stalks you in slow motion. And our DNA is wired to fight or flight. If it's not coming at me in minutes or days, I'm sort of blind to it. Well, COVID is coming at you in minutes and days, and everybody is alarmed. And all the same things are risk factors. So essentially what this pandemic has done has turned America's chronic health liabilities into an acute threat. And there is an opportunity, a crisis and dangerous opportunity. The very things that we're always telling people to do to promote their long-term health actually do fortify your immunity against this virus. If you start eating optimally, start fitting physical activity into your in-place routine, if you maybe get enough sleep, that can affect how your immune system functions in hours, certainly in days, and a whole lot in a span of weeks. There's a better time for America to get healthy. If I were one of the grown-ups in charge of this mess, I would have a national health promotion campaign as part of what we do in an organized way. Look, we're all social distancing, sheltering in place. Let's make lemonade from the lemons. Let's turn this into an opportunity to get healthy. It will protect you in the short run. It'll help protect your loved ones. And when this is over, we'll be a healthier nation into the bargain.
Great point. I really appreciate you doing this. I think you make a lot of sense. I hope I see you somewhere other than Fox News, because I don't like to watch it. All right. Thank you, Doctor.
I understand I'm going to be on your show, Bill, so I'm trading up already.
You'll be on it again, hopefully in person. All right. Take care.
You too. Stay well.